WCVB.com. News Channel 5. COVID-19 emergency in Massachusetts. The latest map and numbers. COVID-19 cases in Massachusetts. State of emergency. Governor Charlie Baker has declared a state of emergency and issued a stay-at-home advisory effective from March 24th to May 18th. Number of COVID-19 cases in Massachusetts, 68,087 cases. 4,004 deaths attributed to COVID-19 in Massachusetts. This is a day-to-day case data. The location of the COVID-19 cases. The county level data. Berkshire 451 plus 3 since last report, 36 deaths. Franklin County 269 plus 6 since last report, 37 deaths. Hampshire County 559 plus 10 since last report, 36 deaths. Hamden 4,066 plus 63 since last report, 398 deaths. Worcester, 6,288 cases, plus 159 since last report, 312 COVID-19 deaths. Middlesex County, 15,370 plus 322 since last report, 972 deaths. Essex County, 9,542 plus 180 since last report, 499 deaths. Norfolk County, 6,280 COVID-19 cases plus 93 since last report, 550 deaths. Plymouth County, 5,507 cases plus 98 since last report, 323 deaths from the COVID-19 virus. Bristol County, 4,019 cases plus 103 since last report, 198 deaths. Barnstable County, 946 cases plus 9 since last report, 47 deaths from COVID-19. Dukes County, which is Martha's Vineyard, 21 cases plus 3 since last report, no deaths. Nantucket, 11 cases, no change since last report. Symptoms of COVID-19. The symptoms are fever, cough, shortness of breath. The symptoms of the coronavirus may appear 2 to 14 days after exposure, according to the Centers for Disease Control and Prevention. All right, guys, so a person can be asymptomatic.
Asymptomatic. Asymptomatic.
All right, guys, so asymptomatic, producing or showing no symptoms, so a person can have the virus without even knowing that they have it. 414 employees tested positive for COVID-19 in a Worcester Walmart. The Walmart location has been shut down since Wednesday afternoon after 23 of the store's employees received positive COVID-19 test results on that day. 391 more employees were tested for the virus on Thursday and Friday. Of those employees, 58 tested positive for COVID-19, while 333 tested negative. Coronavirus pandemic prompts Governor Charlie Baker to order Massachusetts residents wear masks in public. Governor Charlie Baker signed an executive order Friday requiring residents to wear masks in public, including people who take public transit and grocery shopping. We view this as common sense, said Baker. The executive order takes effect on May 6th, so Wednesday, May 6th, you must wear a mask in public. Masks and face coverings are mandatory in grocery stores, pharmacies, and other retail shops, as well as on public transportation. The order does not apply to children under the age of 2 and people with medical conditions who would be negatively affected by the requirement. Businesses are allowed to deny entry to customers who decline to wear masks for non-medical reasons, according to the order. People who are found violating the order could get a $300 fine. Baker said enforcement will be left up to cities and towns. Face coverings are also mandatory out in parks and sidewalks. particularly in times and places where people have trouble staying at least 6 feet apart, according to the order. Baker suggested, for example, that someone who goes out for a run at dawn likely won't need a mask because few people are around. Yet someone who goes out in the late afternoon and walks or runs in the company of others must wear a mask under the executive order because socially distancing will likely be impossible. I think most people should carry it with them and anticipate that they will, Baker said. When my wife and I go for a walk in Swampscott, we carry it. With this new order, Governor Baker and his wife are going to be made to wear the mask. They will no longer be able to carry their mask. Baker encouraged people to make face coverings if they can't buy them, and he urged people to avoid buying medical-grade respirators because hospitals need them. Public health officials say face masks help protect people from contracting the virus from those who are asymptomatic. Dr. Robert Redfield, director of the Centers for Disease Control and Prevention, said earlier this month that asymptomatic transmission could be as high as 25%. Several cities in Massachusetts enacted their own orders requiring residents to wear face masks in recent weeks, including Worcester. City officials said an initial look at the state order shows that it's practically identical and there likely won't be a difference in enforcement. While the governor announced the executive order, protesters with unmasked faces and gloveless hands gathered outside the Massachusetts State House, calling on the state to reopen. The demonstration that started Friday morning garnered a little more than 24 people, including young children who stood beside their parents. One woman held up a sign that read, "Reopen our churches." Another sign read, "Citizens, not subjects." When asked about the protest, Baker said he understands the losses people feel when they can't work, economic and psychological, but that the only way to reduce the spread was through the non-essential business closures, stay-at-home advisories, and other parameters. The guidance that comes out from basically every other country, including this one, has been that until you actually see a downward trend in some of the key indices associated with the presence of COVID-19, it would be a mistake to reopen your economy. Alright guys, so asymptomatic COVID-19, 5 questions answered. I will link this article. I'm not going to read the entire article, alright guys? I am going to point out something that I didn't even know. How can someone spread coronavirus if they aren't coughing and sneezing? Everyone is on guard against the droplets that spray out from a coronavirus patient's cough or sneeze. They're a big reason public health officials have suggested everyone should wear masks. Now here's the thing I didn't know, guys. It says right here, but the virus also spreads through normal exhalations that can carry tiny droplets containing the virus. A regular breath may spread the virus several feet or more. So here's the real concern here, guys. Just a regular breath, just a regular, normal breath can spread this virus. So you don't have to cough, you don't have to sneeze. And if the person is asymptomatic, in other words, they don't know that they actually have the virus, they don't know because they're not experiencing any symptoms, can just exhale near you. And the droplets, the very tiny droplets containing the virus, can spread the virus several feet or more. That is extremely frightening, guys, because you just don't know who has it and who doesn't. Massachusetts has remained open. Convenience stores have remained open. Cumberland Farms, Tedeschi's. Restaurants remained open. Supermarkets, such as Stop and Shop, Shaw's, fruit centers remain open. Gas stations remain open. Things that are closed in Massachusetts. So the things that remain closed in Massachusetts, movie theaters, banks. You cannot go inside a bank to make a transaction. You have to use the drive-up window. Playgrounds, parks, basketball courts, MDC beaches. But as far as everything else, Walmart has remained open, and restaurants have remained open. Hopefully, if people wear masks when they're out in public, that should reduce the COVID-19 coronavirus cases. Alright guys, so stay safe out there, wear your mask, wear your gloves, and protect yourself, because you just don't know if the person next to you or the person that's passing you in an aisle, in a store, or even as you're walking down the street, they could be asymptomatic and not even know that they're carrying the virus. Alright guys, that's gonna do it. Hit that subscribe button, smash that like button, and I'll catch you on the next one.